According to the data collected by McKinsey Health Institute, today, the vast majority of adults across the world can expect to live decades past retirement age. However, while global society should celebrate having on average an additional 20 years of life expectancy since 1960, it has not been as successful in extending the span of healthy life. What can we do about it? Today, my guest is Joanna Bensz, founder and CEO of Longevity Center, net of the world-class clinics that combine state-of-the-art medicine, technology, and person-centered care to make us live longer and healthier. One of them is, and actually the first one, is located in Warsaw.
Yes.
Why healthcare? Why Longevity Center?
In other sectors. Yes. This has been actually a very interesting journey for me because longevity is actually my personal journey. And I was always interested in health. I was always interested in personalized development, in actually everything that makes me feeling good, feeling well, and being effective, and well. And I wanted to actually always engage in this sector. I spent a lot of time in corporates. I was leading a number of international companies, mainly American companies, in Poland, and also involved very strongly with American Chamber of Commerce, which was a great experience, everything together. But I always knew that I wanted to have my own company, in a way. I wanted to establish something in new technologies, in modern technologies, at the edge between technology and wellness. With longevity, I came across longevity by chance. I think I was going to different international conferences, and in one of the conferences, side topic was actually medical wellness and longevity. And I think this is the first time where I've seen David Sinclair speaking. And I think this is something that really, really connected with me. I mean, resonated with me in terms of it interconnected a lot of different areas that I was interested personally. We have started Longevity Center, first one in Warsaw. Now we are expanding in other countries in Europe. But this one is our, let's say, pilot plant, our research and development, and our first proof of concept.
Maybe let's define longevity, because you use this longevity word next to health, but the name of the place is actually Longevity Center. So can you tell us and define what actually longevity is?
And this was our first challenge actually coming to the sector, because when you start investigating, you meet people that are very much into living forever or extending lifespan to, let's say, to no limits. But what we are really interested in and what we are focusing on, and which is very much backed by medicine, by science, we are focusing on healthy longevity, so on the healthy lifespan, as you mentioned, which for many years, we are already living longer, although now with COVID, actually the average length of life has actually shortened in the last few years. But what is really not extending is our healthy lifespan. I mean, ideally, we want to live as long as possible, but in a good health and in full vitality, and being independent and being enjoying our life. This is our aim, our focus, actually, to understand the risk factors that are actually slowing down or inhibiting us from reaching this goal. Therefore, we have introduced a number of different biomarkers that are helping us to monitor and to manage our health effectively.
Okay, so let's start with what we can have when we come to Longevity Center, to answer all those demands that you mentioned.
The first thing that we wanted to find is really my first question to the doctors, that because I'm not a doctor, I'm a manager, and in the company I'm representing the clients. But I employ a number of doctors and also scientists, and the first question to our doctors was, how do you define a healthy person? Because some of the doctors are saying that actually nobody is healthy, but they're just not diagnosed properly.
True, very true. I know this. Yes, we hear it a lot.
But actually, what does it actually mean, really, being healthy? So, of course, there are certain criteria that tell us how much, what our cholesterol should be, what different levels of biomarkers we should have. But generally, this is also changing. Like we are as humans, we are evolving. Some of those standards were set for a very average person, and now when people are living, taking care of their health, and they are already focusing, they are training, they are having a good diet, sleeping well, our norms should be a bit different. So this is why we have introduced biological age as one of the areas that we very strongly promote, different aspects of biological aging. And this is something that also in this sector is very, very important, because at the same time that we are developing therapies for that help us to increase our lifespan or health span, we want to measure it. And to measure it, either we have to observe you have to do multi-year studies, which we don't have usually time for. So in this sector, biological age is one of the biggest trends. How to measure whether some of the interventions, medicine, even diet or exercise, are really influencing our aging process or slowing down our aging process. So biological aging is one of them. There's different ways. We can measure telomeres. We can measure epigenetic clocks. There's a number of biomarkers that we take together that we have actually introduced to the clinic. Some of them are very medical, connected with our cardiovascular health, with our veins, also with our brain, how our brain is aging, cognitive functions, our physical potential, our activity, body mass density. So we combine the medical aspects with a very much scientific approach of biological age and look at different biomarkers that are helping us to measure it.
But what surprised me when I was visiting Longevity Center was that actually you said yourself that a lot of your patients, clients are actually people between 40s and 50s.
Yes.
So
yes.
Does it mean that we actually becoming aware of the fact that health is kind of an investment and make, such a...
to start investing in this area. This is a very good comparison as well, because we also very often say that health is a new wealth. And actually, it's the same with money. If you start investing when you are 60 or 70, obviously your portfolio is going to be slimmer. But if you start investing much earlier, you have a much better chance of even retiring early to enjoy your life. Although this is retirement, we can discuss separately, because it's not so good to retire early for your longevity and wellness. To be serious, like at the beginning, we had to teach people that actually longevity is not really for people 60 plus or 70 plus. Okay. Longevity is at any age. I mean, the trends that we are focusing on. I mean, we are at school, we are not really taught. We are taught how to operate computer. We are taught how to operate any other technology that is becoming available, but we are actually not getting a proper description how to manage ourselves and what really influence our well-being and the fact that we are feeling better or not.
Lessons of biology could be improved, definitely.
Exactly. I mean, it's what we are trying to introduce. It's practical applications of everything that is available, from technology to science to medicine, that help us to manage your health. Because also what is very important, for a lot of people, we are waiting until something is already happening or something happened before we start addressing it. Like in business, if you have a good plan, you can introduce much better management systems than to implement this plan. And also, we talk a lot about personalized medicine because we are all different. There's no one diet that will fit all. There's no one supplement that will help people to live forever. We are very, very different, and we are defined by our genetics. We are defined by our family history. We are defined by the place we live and our environment, and everything that is connected with epigenetic, which influence potentially our genetic expression or not. Because I think that this was amazing for me to learn that we are actually not tied by genetics. We are really, genetic is just in many aspects, because there are certain genes that obviously are much more definitely defining what's going to happen. But in terms of longevity, most of the studies are showing that that only 7% of our genes define how long we live. The rest is up to us.
Just to summarize, in longevity, first you start to examinations with the doctors, yes? So actually somebody can come in and get, let's say, to see what's happening, yes?
Exactly.
On many different areas of your life, and then get some tips Sometimes, of course, some maybe therapies
and a longevity plan. I mean, the basic start with us is really to know where you are today.
Okay.
I mean, you can, of course, start with just measuring your biological age to make the first step. But the ideal scenario is really to come and do a full checkup of where you are today. And some of those tests you do just once in your lifetime to see where you are. I don't know, at 50, 40, 60, what is really your biological age, where you are, what are the risk factors? Because some of those risk factors are showing us that maybe today everything is okay, but if you don't manage this, you know, in 6 months or in 2 years, you might have some problems with your cognitive performance, with your cardiovascular, or maybe with your metabolic syndrome. And there are so many also autoimmune conditions that are also connected with stress, that these are all aspects that we are evaluating in this one day assessment, which takes about 4 to 5 hours. Most of it is in our center, but we also send some of the samples to different international labs that we work with. And then you get your report and recommendation by our longevity doctor, who is coordinating the whole process with our consilium of experts, psychologists, dietitian, and also other doctors. And then you get a plan for your personalized plan for 6 months, 12 months, that you can do at home or you can do with us.
Okay, well, that sounds very good. Well, what is very interesting for me, because we are Poland Weekly, is the fact that you decided to actually open such an innovative center in Warsaw, in Poland. Yes. So tell us more about it, whether it was, what stood behind such a decision. You mentioned that now you're actually expanding to other countries, but at the end of the day, you choose Poland.
Now, we have invested already quite a lot. We have invested nearly 8 million euro in this project since inception, which is about 5 years ago. At the beginning, we had actually thought about opening it in Switzerland, which is a much more established market for this type of services. But I'm glad we did it here because we opened just before the pandemic. And also, being the first clinic in this area in Europe, it really brings a lot of challenges. We have an international advisory board. We have really very, very strong scientific advisors. But actually doing this from basically piece of paper, kind of blank sheet, where we started getting those biomarkers that are already available, that are already validated, and then bring it together with some of the medical expertise. Poland was really a great option for me because I found the right experts here, the right doctors, the right mindset, and also we have this hunger for proving that we are great, we are the best, and for learning. And in my sector, in this area, it's constant learning. I mean, we will never stop learning new things. And I needed doctors that are open to learn, that are open to learning from other doctors, from other experts as well. And I have to say that I have a very, very good team of experts now, and I'm very happy after this few years. Now, from here, we are expanding to Germany. Later this year, we are planning to open Switzerland. So, and then planning to have a few more clinics also in other parts of Europe.
Well, you mentioned doctors, and I checked actually some studies, and it turns out that Poland is also one of the most popular destinations when it comes to the medical tourism. And what I found is that what attracts foreigners are competitive prices, educated medical staff, good infrastructure, and innovation. So is it something that you would like to, build on this trend also for yourself?
Yes. I mean, one of the trends at the very beginning that I really wanted to, go against is that longevity is only for the richest of the richest, because of course you have a lot of investors now coming to the sector, like Jeff Bezos recently invested in Altos Labs. Most of the top, Silicon Valley billionaires are involved somehow in longevity, whether they use the clinics or they invest in the sector. But it is not true that it has to be only a very expensive service for a very unique, for very small number of people. So what we really wanted to do, and this is another reason why we did it in Poland, we wanted to open a clinic where we could bring the prices down for the same services that are offered in Silicon Valley, in other parts of US. Assessment that we are doing here in the same quality, very similar or the same laboratories. In the US will be between 20 to 80,000 euro or dollars. Here in Poland is between 6 and 8,000 zlotys. So it's, of course, for somebody, it seems a lot, but if you compare it with the cost of iPhone, for example, and then value it that you do it really once in your lifetime, and iPhone you possibly change every 2 years, then you might actually look at this a bit differently. And we don't have to start with the whole assessment, but coming back to medical tourism, we get a lot of international guests because of that. Even, you know, like in Switzerland, my partner is from Liechtenstein, so we have quite a lot of visitors from Switzerland and German-speaking area. And it doesn't mean that everyone in Switzerland who can afford it is going to these expensive places. They also want to make sure that they actually compare the quality versus how much they
Price
pay.
per value.
And we really want to bring the cost of some of those services down. It will take us a while because some of those biological ages are only done in our clinic, or some of the interventions are only done in our clinic, or some of the protocols that we then do as a follow-up from the tests. But with time, I hope this is going to be more and more affordable, and it will become as a natural option for everyone to use.
Yeah, so actually we are coming back to the point of priorities in life.
Yeah.
And maybe a broader question that we could have, you know, another 20 minutes discussion on how much worth is our health.
I think everything. I mean, we start valuing this once we start losing it.
That's
once
the problem.
Something is happening in our health, we want to spend any sums of money to get better.
Well, so maybe I would just end up with the metaphor. You had a lot of metaphors to business life, so I would say the same, that now, you know, people say that everything is in data. So that's exactly that now with the technologies, with the growing awareness of a lot of things around us, I think we have a lot of data, but then you need an expert who can analyze them and give you good tips for your life. So I would say that this is something that you can get in the longevity
and this
center.
is something that we really also like, because a lot of doctors are not connecting HRV or VO2 max with the medical tests and results. And I think a lot of people are anyway tracking this and self-tracking different aspects of their well-being. And it's what we are trying to connect is all these data points, and also help you to be able to monitor it yourself and connect it with what has actually happened, what is actually the outcome, and how does it relate. And then in connection with your diet, with your microbiome, with really giving you the right balance of your bacteria and your probiotics and prebiotics. Some of them in diet, some of them supplemented. Yeah, this is just one way of starting your journey to the optimal health.
Exactly. So the optimism is that we can get it all, but we need an assistant and we need somebody who will guide us. So that's Longevity Center.
Now we are very happy, and also all our doctors are fluent in English, which is very important, I think, for your customers. And we are very much looking forward to spreading the news about how to take care of your own health.
Joanna, thank you very much. Really amazing project. Congratulations, really. And, you know, it's always good to be the first. And let's hope that the awareness will be growing.
Thank you, Sylwia.
And people will really invest in health. Thank you.
Thank you. Thank you very much.